There's some issues for young horses, caps and wolf teeth. Wolf teeth are their first cheek teeth that are on the bottom and the top. Most of the horses, they're on the top, and the bottom ones are gone. You won't see them. It's rare that we actually find wolf teeth on the bottom, but it can occur. They occur in males and females, so it doesn't matter. That's often confused with canines, which are usually just male horses. When we find the wolf teeth, we usually remove them, mainly because of tradition. Most trainers insist that they get pulled, whether they cause a problem or not. But it does prevent us from rounding up that first cheek tooth and making a nice bow of a tugboat. So we do remove them so we can get that action. If they come in all shapes and sizes, and they can be inside the tooth or outside or in front, they can be an inch in front. They're variable. They're vestigial teeth, which means through evolution they're trying to get rid of them. Also caps. Caps are baby teeth. Every horse that is born, all their incisors teeth, which are the nipper teeth, and the first 3 cheek teeth on the bottom, the first 3 cheek teeth on the top, are called premolars. They're called premolars because they come with a cap. A cap is just like a baseball cap on your head. It sits on top of a permanent tooth, and as the permanent tooth erupts, it ejects that cap off. During that ejection process, if you're trying to chain your horse, as many racehorses are being trained at that age, these caps can half fall off, can get in the cheek, can cause some rubs and irritations and ulcers in the cheek and on the tongue. They can break off, and commonly, if my fingers represent the little things that hold the cap on, as they come off, a little remnant is left. We call them cap remnants. It's interesting, we just worked on an older horse, and we actually pulled out a couple of cap remnants in this horse because nobody had ever taken them out. They became a nidus of infection. Have you ever ate popcorn and had a kernel of popcorn stuck between your tooth and your gum, and constantly in there with your tongue trying to get it out? That's what these cap remnants are like. So there's a little bit of infection. Once we get those cap remnants out, the gum will heal up and everything will be a lot happier for us. So we have to look for them. Another reason why we like to palpate, because if we palpate with the fingers, we can pick up these cap remnants. If we don't actually pick it up, we'll bring it out and we can smell the infection. We go in and we find that it's just underneath the gum, and we can pull these things out. They're also often on the outside of the cheek, and you can't see that. See a happy horse, a good head shake like that? That's a horse that's happy. That's a horse that's showing signs of relief. This is what we live for. This is what makes it so much fun. The horse is lifting his head up and just saying, hey, I don't know if I want to do this. Aren't you done yet? You know, just like you at the dentist. But you notice his feet are just firmly planted. He's not going anywhere. He's just, okay, go ahead. Just go. Okay, fine. All right. Oh, you're done. Oh, thank goodness. Have I covered everything? Anything I've missed? Old horses. Old horses. I talked about the reserve crown, and as the horse gets older, the tooth that's full grown at 5 years of age has about this much tooth showing, but about this much tooth underneath. As the tooth erupts, it gets shorter and shorter, so there's the same amount of tooth showing and less tooth holding it in position. So with the older horses, we like to make them comfortable, but oftentimes we'll go in there and I'll be able with my finger to be able to move a tooth. And I'm not quick to take a tooth out. If it's not painful and it doesn't stink, there's no bad smell, I leave it in there and make sure the horse can get his tongue around there. I'll come back and it'll be firm in the mouth. If I can go in there and it stinks, there's a bad odor, and I can actually pull it out with my fingers, it's coming out. And a lot of these older horses just get so grateful that that's gone. How often we float horses' teeth is probably the #1 question I get, other than why do we float them in the first place. The rule of thumb is somewhere between 6 months and a year, a horse is going to get sharp enough that it goes from prevention to fixing. And we don't like to fix, because here you are getting ready for your event. You're at the showgrounds, you're ready to go, and you notice that there's something wrong. And now you call the dentist up and he says, yeah, I'll be there in 2 weeks. I'm not coming any sooner. But if you make it a prevention and put it into your show schedule, then we can make sure that these teeth are in good shape. Every 6 months is what we recommend. If they're younger, if they're under 5 years of age, they have all those baby teeth coming out, new teeth coming in, sharp as razors, you need to do it more frequently. As they hit around 25 years of age, you can do it less. There's something else I want to say about how often to float horses' teeth. Oh, their sensitivity to pain. It all depends on how sensitive. Like I had this one owner that she called up every 5 weeks, and the phone call would say, "Doc, it's time," and she'd hang up. And I knew who it was, I knew what I had to do. And I had to go out there. It was a saddlebred, and it was the first cheek tooth on the upper left side, and he always wore it off with his tongue to the sharp point. I'd round it off and be gone. And that's all she needed. 5 weeks later, "Doc, it's time, I have to go back." So every horse is an individual. None of them fall under a category of routine. No, Melissa, you can't take this one home with you.